So if it was safer, easier, cheaper, and got you back on your feet within hours, you'd be interested in hearing more, right? Well, many cardiologists are offering their patients a new way to perform angiograms and stent placement that's a lot less risky, especially for women.
Is that uncomfortable?
No.
Cardiologist Dr. Robert Miner is showing me how he and other heart doctors can access a person's heart through their wrist instead of the traditional practice of going through the groin.
Recent studies of using the wrist as the only place to enter the body for these angiograms and stent procedures show that it's now much safer. Patients prefer it. The nurses who take care of the patients prefer it. It's easier to take care of them. People can go home the same day after getting a stent, and now we see that there's a mortality benefit. You live longer if you have stents put through the wrist as opposed to the groin.
This procedure has been common in Europe for years, but it's catching on here. In fact, Montana is leading the way in this country in offering this procedure to heart patients. Accessing the heart through the wrist is a lot easier on the body.
We think it's a combination of things, but when you go through the groin, you have to go by all the different organ systems in the body, including all the brain arteries to get to the heart. Sometimes we think little cholesterol crystals may break off and go into those organs unintentionally, and that's avoided completely when we go through the wrist.
This procedure is also a better choice for women. Studies show in the U.S., 1 in 4 women dies from heart disease, often caused by a narrowing or blockage of the coronary arteries. Those are the blood vessels that supply blood to the heart itself.
Women have 5 times the risks of men to have bleeding complications that can be very serious, need blood transfusions, or be life-threatening. When we go through the wrist, that risk is identical to men. It's only about a 1% chance of anything happening with bleeding, and so it's really much safer for women especially to have procedures done through the wrist instead of the groin.
It's a procedure done every day at the Billings Heart and Vascular Center at Community Medical Center in Missoula. Dr. Miner says feedback from patients who've undergone heart procedures using the wrist access is 100% positive. He is also studying whether wrist access is a better alternative for a host of other procedures throughout the body.
Now, Friday is Go Red for Women Day to raise awareness about heart health for women. Dr. Miner is hosting a free lecture on how women can reduce their risk of heart attack, how to access the best health care for your heart, and how to know your symptoms of heart disease. This lecture is Friday, February 1st at 7:30 in the morning at the Community Medical Center Gallagher Room. Again, it's free and open to anyone.